Dennis Baker. I was in a lot of pain and kind of looking for somebody that could use the biophysics to basically move my spine. I had had some x-rays, so I knew there were some problems with my spine and that they had to be adjusted or moved. I had seen a regular chiropractor, and that really didn't help much. I mean, it felt better for a little while, but I knew that with my back, being an engineer, that I needed to have some things moved, like braces with my teeth. And I thought that if I could get that spine moved and corrected, that I would feel better, which I do. I haven't had my x-rays yet, but I do know that I feel much better than before I started this program at Square One, and I've been very pleased with the progress that I've made, and staff here was very professional, and I'm real pleased. In the office here, of course, there were the initial exercises that were done every time I came into the office. The neck movement, you know, the flexibility in my neck has increased a lot. And of course, you know, the big thing to me was the traction. There were two main traction exercises that I went through. One to move my lower spine. I've got a disc that is not lined up correctly, and hopefully we'll see that it's moved at least a little bit, or some adjustments been made there. The back of my neck, I feel a lot less work required. I think my head tends to tilt forwards. Being an engineer, that translates into increased moment. So that's where, and yeah, I can feel my neck now. There's a lot less work involved with that. So that's kind of where that's at. You know, the people here have been excellent. You know, you come in, they're ready with your paperwork, you sign in. If you've got any questions, they're always willing to answer your questions. You know, the staff here getting you set up. I had kind of an interesting, one of my attractions was to lay on the bench, and it was a process to get that set up, but you know, the guys were out there getting it set up in advance, and it was excellent all the way around.
Dennis in traction here, pulling up his low back. How's that feel?
Good.
Relax, just taking a nap there?
Yeah.
You got the best traction in the whole office right there.
Yeah.
You're the only one that gets to lay down. So we're just doing traction like he was talking about for his low back.
Well, I would sure recommend they come in and talk to you, and have them take a look at your spine and see how it might be out of alignment. That was really interesting to me to see where my spine was at and kind of where it should be, and then using traction be able to move your spine back into that position, kind of where it should be, not only here at the office, but then there's also the home exercises that I do that, like braces. I kind of consider my home exercises like a retainer to kind of keep it in that position in the future. I'd like to thank Chiropractic Biophysics for the work that's been done there, and Square One for implementing that program with me. Appreciate that.